All right. I'm Sharmarisa Hammonds, and I'm doing my informative speech on the uses of methadone to fight addiction. Addictions can be very hard and frustrating. Addiction to various things like specifically controlled substances or alcohol can be really hard to stop as well. When someone decides that they want to change their life and break the addiction, they may have a very hard time due to the health risks and effects that come along with quitting. Specific drugs in particular that I'm going to be talking about today are opiates. Opiates are similar to heroin or morphine. Morphine is something that's prescribed in the hospital, or oxycodones. Those are prescription opiates. Or if you have the street opiate, which would be most commonly heroin. Addicts to those drugs typically have a harder time due to the harsh side effects of weaning off. For these people, there is help available, and the help that they receive is methadone. So you're probably wondering what methadone is. Methadone originally was created for the management of pain in the early 1900s during World War II, when it was created in Germany, when they had a lot of the Germans had a lot of morphine addicts, so they used it to help manage pain during that era. Methadone is a synthetic opiate. Basically, what it does is the same receptors that are triggered to make you high from the street opiate or the prescribed opiate, it blocks those receptors from receiving that same effect. So the euphoric effect from the brain that you would normally get if you try to shoot up or you try to snort the drug, it would be blocked with the methadone. By doing this, it helps to prevent, for addicts, it helps them to be able to wean off of the actual drug itself. You get methadone through a clinic. It is something that is prescribed. You would go to a clinic daily and they would have a certain amount based on the opiate addiction that you have. So typically, most American addicts start at 80 milligrams, and somewhere between 80 milligrams and 125 milligrams, whereas you can get all the way up to 325 milligrams, which normally would kill someone. But based on the dependency that you have developed from your addiction, it's going to depend on how many milligrams that they give you. It can be given in a tablet, or it can also be given to you in the form of like a drink, and you would come to the clinic and they typically just serve it to you there, and you take it there and then you go home from there, and it usually lasts about 8 hours. Some of the side effects that methadone does have, obviously nausea and vomiting between dosages can happen. That's typical with any opiate at all. And also because because it's considered an opiate replacement therapy, it does carry some dependencies, such like what most opiate drugs do. The weaning off process of weaning off of the methadone can be very hard as well, mainly because they take your regimen and they break it down by week, and they give you less and less and less until finally you don't need any more. When you get to your final stages, you are actually inpatient for 10 days, and they wean you all the way off until you no longer need it. So because of that, and because this drug is available to people, a lot of times the dependency on it can be a lot longer than what is intended by the patient. A lot of times, addicts, they just have a very hard time fighting the fact that they won't be able to get that same high at all anymore. So a lot of times it ends up getting stretched out until the clinic decides that you can no longer receive any more dosages of it. On the good side though, methadone has helped a lot of heroin addicts, a lot of prescription drug addicts to get clean. If it's managed properly and if it's done correctly, you can actually end up not needing to use any of the drug or the methadone itself, and it will help change things around for you. It's provided at a very low cost as well. So if you are an addict and you want to get the help, it is affordable for you to do it. I definitely would say that out of all the advantages of it, I would strongly recommend that someone with an opiate dependency to try and do the methadone clinic if they're going to try to get clean, because I feel like it would help them majorly with the withdrawal symptoms, and it will help them be healthy without having to go through so much pain.